Let's talk about the restoration of noncarious cervical lesions. Because what we want when we restore a noncarious cervical lesion is a beautiful appearance like we have here. We don't want to see a restoration with an unaesthetic appearance like we have here. We don't want a restoration that has leakage like we see here, because essentially what we've done here is taken a noncarious cervical lesion and we've converted it into a carious cervical lesion. We don't want this either, where our restoration is lost, in this case after only 3 months. There was an interesting study that was published a few years ago in the Journal of the American Dental Association that looked at 2 of the common restorative techniques for restoring noncarious cervical lesions. And these authors did a 2-year evaluation. The first material that they looked at was composite resin. And what they found with composite resin was that the composites delivered superior aesthetics. These were very beautiful restorations. They had nice contour. They had nice polish. They retained their polish for the full 2-year duration. But the problem with the composites was in their retention rate. These authors found that after 2 years, 1/3 of the composites were lost in the noncarious cervical lesions. 1/3! That's totally unacceptable. Let's take a look at what happens when we place a composite restoration on enamel. We etch the enamel and we achieve these grooves and channels between the enamel prisms. And when we flow our composite adhesive over this surface, the composite flows into these channels, and then we cure the adhesive, and it locks it into place mechanically. We achieve mechanical retention. Contrast that appearance with what we have here, which is the appearance of etched dentin. All right, who knows what these large openings are in the surface of the dentin? These are the dentinal tubules. And when we etch dentin, we open up these dentinal tubules. Now what about this shag carpet appearance that we see here? What's that? That's the collagen matrix of the dentin. When we etch away the calcium content, we leave behind this shag carpet of the connective tissue fibers of dentin. So now when we take adhesive and we flow it over this surface, the adhesive flows into these tubules, the adhesive wraps around these fibers, and then we cure the adhesive, we harden it, and we achieve mechanical retention in that manner. But the problem with noncarious cervical lesions is that they have sclerotic dentin, hard dentin. And sclerotic dentin doesn't etch. It doesn't etch well. You don't get this type of appearance with sclerotic dentin. So you don't have the ability to achieve mechanical retention like you do in normal dentin. And that's why the author surmised that 1/3 of the composite resin restorations were lost after 2 years. Let's look at another material, the resin-modified glass ionomer. Resin-modified glass ionomer is a hybrid material. It's a hybrid of glass ionomer cement, and I'm sure you're familiar with that. It's a good cement. Resin-modified glass ionomer has resin, composite resin, it has the glass ionomer cement, but the characteristics are actually more like that of glass ionomer. And the important feature of glass ionomer is that it retains itself in the tooth with chemical retention. It forms a chemical bond to the dentin. It's not mechanical, it's chemical. And so what we found with this study, they evaluated the material Vitramere, which is also a 3M product, but it's a very old product. It's probably been on the market for 20 years. Well, Vitramere had a perfect retention rate. Every one of the Vitramere restorations was present after 2 years. The problem was in the aesthetics. Vitramere doesn't polish very well, so it didn't have a smooth luster. The shade match was terrible in several cases. It's hard to shade match Vitramere. And so it got a bad grade in terms of aesthetics. Perhaps what we need is a combination technique. We need to take the best features of the resin-modified glass ionomer, and we need to combine those with the best features of the composite resin. 2 of the newest materials on the market today are Ketac Nano by 3M, their resin-modified glass ionomer, and Filtek Supreme Ultra, also a composite resin by 3M. What's exciting about these products is in the technology of the filler particles, because these filler particles are very small particles. They're actually made of zirconia, which is a very hard, very durable material, But what's interesting about 3M's technology is they can sinter these particles into very small sizes, and then they can fuse them into clusters. So we've got these fused particles forming a nano cluster. What this does is it gives the material the strength of a hybrid from the nano cluster, and it gives the material the polishability of a microfill resin because of the nanoparticle. Let's take a look at a graphic illustration. We see a filler particle of a competing product. It's about 600 nanometers in diameter, about the same size as a nanocluster, but this is just one particle. The nanocluster is actually made up of these particles which can measure between 20 and 75 nanometers in diameter. Keep in mind that a nanometer is about 1/1,000,000th, it's not about, it is 1/1,000,000th of a meter. So we're talking about very small particle size. If we look at this scanning electron micrograph, we can see the different particles and their effect on what happens when we polish the material and as the material wears over time. If we lose this large particle, then what's going to happen is we'll deteriorate the luster of that restoration, because in effect we're creating a pothole in the surface of the restoration. If we compare the appearance with the Filtek Supreme Ultra composite, this is one of the nanoclusters. But as this material is polished and as this material wears, you don't lose the entire cluster. What you lose are just some of these individual particles from the surface. So instead of getting a pothole effect, we just get some minor dimples in the surface. And that's why they say that this material gives you the strength of a hybrid but the polishability of a microfill. Also in your handout is a step-by-step approach to how to restore these types of lesions. And that's on the first page of your handout. And what I'm going to do now is just take you through the restoration of non-carious cervical lesions with two techniques. We're going to utilize just the Keytac Nano resin-modified glass ionomer, and then we'll also veneer the resin-modified glass ionomer with composite. The first thing we want to do is get our shade match. This is shade A3 in this patient. And I'm going to anesthetize the patient and pack retraction cord. And packing retraction cord is an important step, but unfortunately it's oftentimes omitted. And I'm going to tell you in just a minute why it's such an important step to include. I'm pumicing the surface, cleaning the surface with pumice of this non-carious cervical lesion, and we're going to rinse this off and then inspect the root surface closely, because what we don't want is any residual calculus. If there's any calculus on the root, you've got to clean it off and pumice again. We want a clean root surface. This is the primer that comes with Keytac Nano. Remember that Keytac Nano resin-modified glass ionomer forms a chemical bond to the tooth, and it's this primer that helps to achieve that chemical bond. So the primer is applied, and then we spray some air on the surface to just thin that primer out evenly, and then light cure for 10 seconds. This is the resin-modified glass ionomer, and it comes in these cool little capsules. And in order to activate the capsule, you simply straighten out the nozzle. And then you put the capsule on your applicator, and first you want to dispense out about a peppercorn size piece of this material, and just discard that because it's not fully mixed, but everything that follows is properly mixed. So you apply the material directly to the root surface, shape it with a shaping instrument, and what you'll notice is that with this resin-modified glass ionomer, at first it has a tacky feel to it, and it kind of pulls back with your instrument. But if you'll dip the instrument in the primer, then you can go back to your restorative material and you can shape it without that tug back. And then you want to light cure for 40 seconds. Now, here's why it's important to pack the retraction cord. Because I'm finishing the surface now with a tapered needle-shaped diamond burr. And what I want to do is get the surface of that restoration even with the root surface. Because if you don't even that material out to the surface of the root, then what's going to happen is you'll end up with a ledge at the gingival margin. And that ledge is going to trap plaque. And that plaque is going to cause inflammation. And that inflammation is going to make your periodontist very sad. So let's keep our periodontist happy pack some retraction cord, and polish that restoration and finish it to the root surface. Now I'm polishing with a Softflex disc